Goeienaand, good evening, fellow South Africans and citizens of the world. And if you think South Africa somehow has dodged a bullet when it comes to the coronavirus because the official infected number of people appears to be slowing dramatically over the last few days, think again. There are two reasons this is happening. One is because those who've been able to afford to get a test, remember it costs about 1,400 rand if you don't go to the public hospital. Those who've been able to afford are normally white people, and they're normally people who have a bit of this to throw around. Not so much the Africans in the townships. Now, I've reported just yesterday on cases where people with all the signs of coronavirus have gone to a public hospital. These are white people, and they have refused to give them a test for coronavirus because they didn't have any supplies of the kits. Nice. They were just sent home. So there's a great disparity here between the people who can afford to have testing done, and clearly the big jump originally was because people who are really sick came forward and they tested positive, but now it's slowing down because those people who can afford are not feeling sick, the rest, so they're not actually having the test done. But when you talk about the wider community in South Africa, this thing is just flying through the community and no one has any idea on the numbers. We've had a few confirmed cases in the bigger townships. Imagine how those things are spreading right now. Now, in about 2 weeks' time, let's say about mid-April, we should start seeing a huge spike in infections and people showing the symptoms of the coronavirus. So let's see if I'm right or if I'm wrong. But I'm not the only person saying this. So, I've got a lot of people who are now starting to see my way of thinking. And this is from the Financial Mail, who writes as follows. There is something very peculiar about South Africa's COVID-19 numbers. From March the 21st to March the 24th, there were 352 new cases, an average daily increase of about 28%. In the 4 days after that, the number of new cases increased an average of 21%. But in the 4 days ending on Wednesday, April the 1st, there were just 193 new cases, a daily average increasing of 3.84%. What on earth is going on? The most likely answer is that the numbers are incorrect and that South Africa is missing many cases. Health Minister Zweli Mkhize, for one, seems to realize this, as he warned on Wednesday. The small growth we are currently experiencing is coming before a devastating storm. By Wednesday night, the number of COVID-19 cases had officially risen to 1,380. Mkhize knows this increase, just 27 on the previous day, is low, which is why he said the government's plan is to try to identify what the real situation is by finding cases in poorer and under-tested areas. This is what I've been talking about from a month ago. I've been saying this is where the damage is going to be done in these townships, especially where you've got TB and AIDS and the immune deficiencies are low. I think it's going to be catastrophic, but we'll see. Ominously, Mkhize suggested the disease is spreading silently. In other words, what's happening is that people are passing it on to each other while they're asymptomatic. And even when they get the symptoms, they're too poor and probably have never heard of the coronavirus, so they're probably just sniffling around at home, infecting the rest of the family. Mkhize explained that not enough poorer people were being tested. He was referring to people who had not traveled abroad and who had mild symptoms, particularly those who, when sick, do not seek assistance immediately. He said, well, why would you waste your time at a public hospital when they don't have any public testing kits available? Crazy. Of the 44,200 tests conducted so far, only 6,000 have been done in the state sector. This suggests that at least 80% of all tests have been on middle-class people who can afford a private lab test, and that not enough tests have been conducted on the 84% of state patients who are without medical aid. That is exactly my point. So those who went forward when the test kits came out, who could afford to pay, they were the reason for the sudden surge. And now that they've stopped coming in, because they're not actually testing the poorer people, it looks like this virus is petering off, which it's not. It's actually going ballistic. Experts spoken to by the Financial Mail this week says South Africa shouldn't think that the spread of infections have somehow halted. A more likely explanation is that we're missing confirmed cases and that the reported numbers aren't reflecting reality at this point. And that's when clusters start forming. You get everybody infecting each other, and you get this huge group of people in a particular area that now have the coronavirus. Still, the number of infections is below the original predictions, which is good news. A team of experts has modelled an expected 4,000 cases by April the 2nd and expected 7,000 without a current lockdown. We're beating those projections. However, the strange numbers make it much harder to predict future cases and to project the number of hospital beds that will be needed. It also makes any diagnosis of the success of the lockdown tricky. If, for example, we see a marked increase in cases next week, it may lead people incorrectly to think the lockdown isn't working. Well, it's all hocus pocus. It really is. Like everything else the ANC government do, they've failed. They've failed. In fact, the increase could be marked. For one thing, testing is becoming both more ubiquitous and more comprehensive. Mkhize says the government will begin adding a serology test, essentially a blood test, to detect COVID-19 antibodies. This could indicate a previous infection, which can be misleading and lead to unnecessary quarantines, whereas the more time-consuming lab tests detect a current infection. Also, the National Health Laboratory Service, or NHLS, is repurposing gene expert machines that have traditionally done tuberculosis testing in this country so that they can be used to test for the coronavirus, and the results are available within 45 minutes, as opposed to 10 days, which is the current situation, which is totally ludicrous. Here South Africa has an advantage. We have 180 of the gene expert machines, the highest number in the world, because we have so much TB in South Africa. The machines was designed in the US, but the test to check that the machine is correctly performing tuberculosis tests has a proudly South African connection. Let's explain. To roll out testing on machines all over the country, one needs a test to check the machine is giving a correct result, rather than false negatives. So that test needs a test, a validation, in other words. The simple, portable, and cheap test to validate that a gene expert machine in far-flung Eastern Cape is giving correct TB results was designed by Johannesburg professor Leslie Scott. Scott and her team are now looking at a way to design a test to validate the gene expert results for COVID-19. As soon as the validation test is ready, which Mkhize says will be early next week, it can be used. The NHLS has bought 60 mobile labs, which look like fancy minibus taxis, each to be kitted out with 4 gene expert machines. The labs can drive to where communities live and test thousands of people a day until they get robbed. Anyway, but more tests mean more cases, which risks making the lockdown appear ineffective. The consequences of not testing early enough have been nightmarishly clear in the United States. At last count, there were 190,000 cases in that country, and 4,127 people have died from the virus. But if South Africa is struggling to understand what's happening with its numbers right now, statisticians in the US have been equally wrong-footed. Each week, infectious disease experts and epidemiology gurus from the top US universities have been asked by statisticians for their prediction on the number of COVID-19 cases for the country. 2 weeks ago, biostatisticians at the University of Massachusetts, Thomas McAndrew and Nicholas Reich, asked infectious disease experts and epidemiology gurus from the Ivy League universities, including Harvard and Johns Hopkins, how many Americans they expected to be infected by March 29th. Their answer was 19,000, according to Nate Silver's website, 538. In reality, that number was more like 136,000. The best in the business were wrong by many, many multiples. This wasn't a one-off either. On March 16th, McAndrew asked the epidemiologists what their models suggested the numbers would be by March the 23rd, and their average answer was 10,567. But the number of cases at that stage was more than 40,000. It shows how models being used to predict the spread of COVID-19 are often flawed, but this is through no fault of the researchers. There are, as some have said, just too many unknowns to plug into models. It may explain why US President Donald Trump, widely derided for his COVID-19 response, initially said life could return to normal by Easter. He later shifted the prediction to June. The US's problem in the critical first weeks was a lack of testing. It's a mistake that Mkhize doesn't want to repeat, and why he is adding the serology tests and harnessing the gene expert machinery. While this is indisputably a good thing, there are unintended consequences to this that Mkhize will need to manage deftly, as the increased number of tests is likely to make confirmed cases soar in the next few weeks. It could make it seem incorrectly as if the lockdown isn't working, and South Africans, some of whom are already angry about the sacrifice, won't want to believe they're sitting at home for nothing. But President Cyril Ramaphosa will have to stand firm if that happens. At the moment, the only way to control the disease is through the measures South Africa has implemented. Now, I've seen 3 extensive or long videos of this African guy traveling through Tembisa Township. And it's like, as he says, it's like there was no lockdown. There's no police there, there's no army there, everybody's walking around as if it's just a normal day. This is this week in Tembisa. Think about it. All right, guys, please remember to subscribe to be kept informed. Ring the bell for the updates. Please like this video, please share this video, and above all, please stay safe.